Hey everyone, welcome to another video, which is a second video of hospital acquired infection. So in previous video, we studied about the definition, factor causing infections, then about sources of infections and the microorganisms causing hospital acquired infection. So in this video, we'll be studying about the modes of transmission of the infections. So there are four main routes of transmission of infection. It could be contact, that is a principal route of transmission of nosocomial pathogens. So it could be either through hands or the clothing. So hands of hospital infection is one of the main vehicle of spread of infection. And there is an adequate scope of transmission of microorganisms from one person to another by contact of hands and clothing of the attendants also. Staphylococcus aureus and Streptococcus pyogenes are the two important pathogens spreading by hand contact. So the contact is a principal route of transmission. There are two types. One is hands or clothes or inanimate objects. So in hands or clothes, it could be the hands of hospital staff or the hands and clothing of the patient attendees, the one who comes along with patient to look after the patient. So these are the different vehicles of spread of infection. So usually there are two types of pathogens that have been causing hand contact infections, which are Staphylococcus aureus and Streptococcus pyogenes. Moving to the second type of contact, which is inanimate objects. So these could be medical instruments like endoscope, bronchoscope, and cystoscope. So if they're not properly disinfectant or sterilized properly, it can transmit to pathogenic organisms. One such microorganism that has been spread through these instruments are Pseudomonas aeruginosa. So that is one type of microbe that is being causing infection. Moving to the second type of modes of transmission is airborne through air, either by droplets. Droplets of respiratory infection is transmitted by sneezing or by coughing. The droplets of the person's secretion could move in the air, and the air might cause, on inhalation, the air might cause airborne transmission of infection. Then dust from the bedding or the floors or the exudate dispersed from the wound during dressing, and from skin by natural shedding of the skin scales. In case of measles, staphylococcal sepsis, and these might contribute to the infection. So, Pseudomonas aeruginosa and the Staphylococcus aureus are the microorganisms that have been causing infection by spreading through these dust particles. So, the dust could be from bed or from the floor, or the exudates that are the exudates, in the sense the secretions that are being released from the wound healing, or the wound being dressed from the gauze and cotton. Moving to the aerosols, the third type of airborne diseases. Aerosols could be nebulizers or humidifiers and air conditioning apparatus. So these could also cause transmission of pathogens to the respiratory tract. Occurrence of Legionella in hospital water supply has led to outbreak of infections, mainly with Legionella pneumophila. So this is one type of microorganism that is being transmitted through the water supply of a hospital infection. So the water from the hospital should also be properly sterilized. Otherwise, the infection might spread through water supply also. Moving to the oral route, the hospital food may contain antibiotic resistance bacteria like Pseudomonas aeruginosa, Escherichia coli, Klebsiella species, and others. So these are different microbes that could be spread through the food oral route. So these colonize in the intestine and later cause infection in susceptible patients. Moving to the parenteral route, another mode of transmission. So this could be from the disposable parental route. Usually, the adoption of disposable syringes and needles avoids the transmission of infection, but certain infections might be transmitted by blood transfusion or tissue donation. Contaminated blood products also. and contaminated infusion of the fluids. So HBV and HIV are the two viruses that are being transmitted in this way. So these are the two viral infections that might cause hospital acquired infection. So the common health associated infections are urinary tract infection. So this is usually associated with catheterization or instrumentation of urethra, bladder, or kidneys. So these are the excretional wastes or waste that are being excreted through the organs like urethra, bladder, or the kidneys. So catheterizing or instrumenting these organs might cause infection. So the urinary tract infection is associated with catheterization and is named as catheter associated urinary tract infection, CAUTI. So that is the name that is being for the given for the infection that is being associated with catheterization. So infection is used. So what is this catheterization in first place? So catheterization is done in patients who are not able to pass out urine after a surgery. So if a patient undergoes a surgery, he can't be able to walk or get up from his bed and go urinate. So he'll have to be on bed and have to go under a rest. So catheterization is done in such patient who cannot pass urine or walk or move around. So the infections that are causing urinary tract infections are Escherichia coli, Klebsiella proteus, Serratia, Pseudomonas, Providencia, coagulase negative Staphylococcus, Enterococci, Candida albicans are the different microbes that have caused UTI. So the infection can be prevented by strict asepsis during catheterization. So strict sterile techniques must be adopted whilst catheterization, and if it isn't done properly, there are chances of getting urinary tract infections. Moving to the respiratory infection, aspiration in unconscious patient and pulmonary ventilation may lead to nosocomial pneumonia. So aspiration and pulmonary ventilation without a proper sterile technique, it might cause nosocomial pneumonia. So these respiratory infections are usually called as ventilator associated pneumonia. So the major pathogens that include are Staphylococcus aureus, Klebsiella species, Enterobacter, Serratia, Proteus, Escherichia coli, Pseudomonas aeruginosa, Acinetobacter, Legionella pneumophila, and other respiratory viruses have been causing ventilator associated pneumonia. Moving to the wound and skin sepsis, the incidence of post operative infection is higher in elderly patients. The most wound infection manifests within a week of surgery. So, the Staphylococcus aureus is a predominant pathogen and followed by a Pseudomonas aeruginosa. Other different types of microbes that have been causing surgical site infection. Escherichia coli, Proteus, Enterococci, and coagulase negative staphylococci are the different microorganisms that have been causing wound and skin sepsis. So during the healing of the surgical site, there might be infections. This could happen within a week of the surgery. So the chances of infection of the region where the wound is healing after post surgery is a very good site for the infection. So the dressing must be done properly and should be changed very routinely in order to avoid the infection of the site. Gastrointestinal infection could be due to food poisoning or neonatal septicemia in hospitals. Neonatal is when the child is being born, when the infant is being born. So these are called neonates. These neonatal septicemia is bacterial infection or pathogen infection. Usually Salmonella and Shigella sone are the two main microorganisms associated with gastrointestinal infections. Moving to the burns, the other type of commonly health associated infection are Staphylococcus aureus, Pseudomonas aeruginosa, Acinetobacter, Streptococcus pyogenesis are the different microbes that cause infection in case of burns. Bacteremia and septicemia. These may be consequences of infection at any site, but are generally caused by infected intravenous cannula. So these could be from the intravenous IV cannulas. Then gram-negative bacilli are the common pathogens. The infection can be prevented by proper skin toilet before cut down. So well before cutting in through the skin, the area should be cleanly disinfected with the spirit or the Savlon or the betadine, the different types of disinfectants that are being used in order to avoid skin skin microbes to penetrate into the skin and into the intravenous area and cause infection. Intravenous rehydration in diarrhea should be replaced by oral fluids as early as possible. So usually when the dehydration happens, intravenous rehydration is being done. Intravenous rehydration is administration of fluids in common terms. So whenever there is dehydration, they put cannulas into the skin of the into the vein of the patient and give intravenous rehydration therapy. But that should be avoided and should be given with oral fluids like ORS, which have high electrolytes in them. So this can avoid infection through the intravenous. Then Staphylococcus epidermidis bacteremia is commonly found in patients with artificial heart valves. So patients with artificial heart valves might be at higher risk with infection of Staphylococcus epidermidis. Bacteremia in those with valvular defects may lead to endocarditis. So this bacteremia, that is infection from the bacteria, might lead to valvular defect and finally lead to endocarditis. Moving to the diagnosis and control of health associated infection, it is usually done with the routine bacteriological methods such as direct smear examination, culture of the specimen obtained, and the sensitivity testing. So these are the different diagnostic methods in order to examine the bacteria that is being present in the hospital premises. This requires a sample from possible sources of infection like hospital personnel, inanimate objects, water, air, or food that is being seen in the hospital environment. Typing of isolate, phage typing, bacteriocin typing, biotyping, or antibiogram are the different connections that are being given to keep a record of the infections that are being observed in the hospital environment. So, the control of hospital infection can be done by various ways of one such example of sources of outbreak could be the nasal carriage of staphylococci in hospital staff. In the sense, the hospital staff might acquire cold or the infection from staphylococci. On sneezing, the staff might spread it to the other patients also. Pseudomonas growing in lotion. Usually, these pseudomonas are so much resistant that they grow in antibiotic lotions also. So these lotions on again usage of it might lead to infections. This could be carriers. So these carriers should be suitably treated. The cause of infection may be defective autoclave. So one such cause of infection is defective autoclave. Therefore, sterilization techniques should be tested every time when sterilization is done. Unfortunately, in many hospitals, infection control is attempted by use of more and more antibiotics. So in certain hospitals, they prefer giving more and more antibiotics, thinking that the infection might go in administration of antibiotics. But these giving more and more antibiotics might lead to multi-drug resistance or multi-antibiotic resistance in the pathogens, which is much more harmful to cure in future. So the selective colonization of multi-resistant pathogens and has a harmful effect. So these bacteria on administration, bacteria or any pathogen on administration of antibiotic might acquire a character of being resistant to those antibiotics, which might lead to which might lead to difficulty in removing the colonies which have developed the multi drug resistant property in them. So that completes diagnosis and control of the hospital acquired infection. So the prevention of hospital acquired infections could be by controlling the transmission by proper hand washing techniques, disinfection of equipments properly, and change of the working clothes. Administration of antibiotic therapy to carrier staff or the source of patient to destroy the pathogenic agents. Proper sterilization and disinfection of the and inanimate objects should be done. This helps to control the source of infection. Disinfection of excreta and infected material. If necessary, it is to be controlled to control the exit points of infection. The use of sterile dressing, surgical gloves, face masks, and IV fluids rather further contribute to the control of infection. Preoperative disinfection of patient skin. Rational antibiotic profile access. Proper investigation of hospital associated infection and treatment of such cases. So that are the different types of different ways of preventing the transmission of infection. Moving to the infection control policy, so every hospital must have an effective infection control committee. So this committee should be responsible to control the health associated infection. So the committee must contain a chair by a medical superintendent and should have a microbiologist also as an infection control officer and head of all clinical departments, blood bank, microbiologist, medical record officer, chief of nursing or services, and infection control sisters as member. So the chief of the supportive services should be included as invited members. So the OT, dietetics, laundry, housekeeping, etc. are also important part of this committee. So ICC must meet at least once every month to formulate and update the policy on matters related to hospital infection and to manage outbreak of health associated infection. The committee will review infection control activities of the patient, emergence of drug resistance, use of different antimicrobial agents, sterilization and disinfection procedures, hospital environment, incidence and types of infection, antimicrobial sensitivity patterns of prevalent pathogens. So these are the different things that uh, has to be reviewed in their meeting of every month. So the committee must look through all the various ways of hospital acquired infection and should come to a very good conclusion so that the hospital acquired infection might not spread to the other patients also, and in order to avoid the mortality rate of the patient. So that is how hospital acquired infection can be controlled. So this completes the chapter on health associated infection on the hospital acquired infections. Thank you. I hope you like the video. Do subscribe to the channel. Thank you.